Hello and welcome to today's meditation moment. My name is Renee Johnson and I'm a wellness coordinator here at Kapnick Strive. I'm also a certified yoga instructor and meditation facilitator. And for today's practice, I thought we'd do something a little bit differently than just straight meditation and focusing on some different breathing techniques that are great for relieving stress and focus and really affect the body and how it functions. And as we go through each of these practices, we'll have some time to practice them, and I'll also tell you the benefits of those practices as we go. So before we start, like I said, I'd like to do a couple of the housekeeping. You may want to have a tissue handy. It does help when you're doing these breathing techniques to be able to clear your nasal passages. So without getting into any more detail on that, it can make the techniques much easier, much more comfortable. Second, if any of these techniques cause you lightheadedness, dizziness, nausea, feelings of anxiety or agitation or shortness of breath, please discontinue them and allow your natural breath to come back. Because these breaths, as I will discuss later, affect the parasympathetic system, it can cause some anxiety to come up for people. So if one of the techniques doesn't work for you, that's fine. Just let it go, and maybe the next technique will seem a little better for you. So just being aware and listening to your body as we go through these practices. And as I said, we'll practice each of these breaths, and it'll be about 2 to 3 minutes. I'll go over the benefits of each one, and then we'll have a little bit of a grounding session at the end of this practice. So, and if any of these breaths call to you as we're doing them and you're like, nope, Renee, I really want to do this the whole time, feel free to do this. This is your practice, and I want you to embrace what your breath is telling you today and your body is telling you that it needs for you to do today. So before we start the first breath, finding that comfortable position and whatever that looks like for you. If you are lucky enough to lie down, sometimes these breaths, especially learning them, are easier lying down. If you are seated, sitting up nice and tall, feet grounded down into the floor, allowing the top of the body to be as relaxed as possible and allowing the hands to drop into the lap. And as we're going ahead and getting in that comfortable position, I wanted to share with you, and I'll share this quote again at the end. It's a quote from Thich Nhat Hanh, and he's a Zen Buddhist monk, and it was in his book, The Miracle of Mindfulness. And he says, the breath is the bridge which connects life to consciousness, which unites your body to your thoughts. Whenever your mind becomes scattered, use your breath as a means to take hold of your mind again. And a lot of these breaths are great for focusing. So as you're going through your day, you're feeling stressed, you can't focus, stopping just for a few moments can really help with these types of breaths. So the first one we're going to discuss is called diaphragmatic breathing. It's also called belly breathing. It's a technique, used to promote relaxation and reduce stress by using the diaphragm to breathe deeply. So how this works is you're going to go ahead, sit up nice and tall, and on the inhale, you're going to go ahead and allow your belly to blow out like a balloon. And on the exhale, the navel comes back to the spine. Inhale, navel goes out. Exhale, navel back. Now it might feel a little funny, but just continuing that breath. Inhale out like a balloon. Exhale, navel back. Continuing with this breath, nice, slow, steady breaths. So what's happening in this is when you're actually inhaling, allowing that belly to float out, the diaphragm is allowed to drop down. And on the exhale, when you're pushing your stomach back in, the diaphragm pops back up towards the lungs. So when we're doing this and allowing that inhale, it allows the diaphragm to drop down and allows us more lung capacity. It allows us more oxygen. And it allows the tissues and all of the body to be nourished. Nice, slow, steady breaths. And this can also lower blood pressure. So I always tell people when they're getting their blood pressure taken, if they're really stressed, this is a great one. It only takes about 2 or 3 rounds and you can drop your blood pressure about 10 points. This is the breath. If you ever watch a baby breathe, the belly goes up and down. So this is also called our natural breath. And with each round, releasing the tension in the jaw and the shoulders. Some people like to put one hand on their chest, one hand on their belly. Feel free to do that to feel that movement. Again, if any of them are causing stress, just let it go. Nice. And they suggest a regular practice of this about 5 to 15 minutes a day, a few times a day. And again, just allowing that diaphragm to drop down and allowing it to come back up. So that was our first technique. It's called diaphragmatic breathing. The second technique we're going to talk about is called box breathing. It's also known as square breathing. And if you think about a square as being like 4 across, 4 down, 4 across the bottom, and 4 on the other side, what we're looking for is equal breaths as we go through each side. And that number is normally 4 to 6, depending on how strong of a breath that you have in an inhalation. So what we're going to do is we're going to inhale the breath for a count of, say, 4 to 6. We're going to retain that breath at the top for that same 4 to 6 number. Allow the exhale to come down, same number. Retain again at the bottom while we're not inhaling or exhaling, that same number, and then starting again. So that's kind of how the technique is used. And this one is used to calm the mind and the body. It manages stress and anxiety. And in fact, the Navy SEALs use this breath to teach focus. This is the breath that they use before they go into battle to teach their minds to calm down and relax. Again, it's engaging the parasympathetic system that's keeping us out of fight or flight. So we're going to go ahead and practice this. Sometimes it's called the 4-4-4 breathing. Again, whatever number that looks like for you. And again, like I said, we're going to practice this for probably about 2 minutes. So finding whatever number is comfortable for you. We're not trying to stress our bodies out. We're not trying to cause anxiety. So don't make it where it's difficult for you to do. Start lower numbers and then increase if it's too easy. So finding your number, go ahead and increase for that number, whatever that is, and it'd be like 1, 2, 3, 4. Retaining it for 4, 1, 2, 3, 4. Exhale, 1, 2, 3, 4. Retain that breath, 1, 2, 3, 4, and then beginning your inhalation again. So I'm going to go ahead and let you do that on your own for whatever count that is. Again, those numbers are the same. Inhale, retain, exhale, retain. Just finding what works for your body in this moment. If you notice you're gasping for air, the number's too high. Slow, steady breaths. Relaxing the jaw. Noticing how the body feels. Not a competition. Being kind to yourself. Nice. And go ahead and complete that last round. As you do, just nice deep breath in. Let it go. And then we'll go ahead and introduce another technique. It's called alternate nostril breathing. And this one takes a little bit more concentration than the other ones. It's a little bit more, we have to use our hands to do it as well. I've seen where people do it mentally as well. You can try to practice it that way. But traditionally, it is done with the hand. So using whatever your dominant hand is, you're going to go ahead, take your palm open, and you're going to go ahead and take your index finger and your middle finger and drop them down towards your palm so that your thumb and your ring finger can act as little pinchers, basically. I don't know if you can see the picture in the meditation moment. That's kind of what she's doing there. So you're using your ring finger, and then she's going to bring her thumb over in that photo. Another thing you can do is if you have arthritis in your hands or any damage in your fingers and you can't do that, you can leave those two fingers up and just place them on the brows right between the center of the eyes. But what we're going to do is we're going to go ahead and take those pincher fingers, and you're going to go ahead and bring your thumb to your right nostril, right above that nostril. And we're going to go ahead and just gently place it there. So that leaves the left nostril open. You're going to go ahead, inhale through that left nostril all the way up. And then you're going to pinch off that left nostril and exhale out of the right nostril. Then inhale through the right nostril, pinch it off with the thumb, exhale out of the left. And then go ahead, inhale the breath up, pinch it off, exhale out of the right. Might take a little practice moving back and forth, but you're always inhaling and exhaling out of that same side before you move across. So nice, slow, steady breaths. And again, we're not trying to jam our thumbs through our noses. It's a gentle press. And just alternating the nostrils as you go in and out. So as you go ahead and continue practicing this, again, at your own pace, inhale, crossing over, exhale, inhaling again, crossing over, exhale. So what the alternate nostril is doing is it's actually balancing out both sides of the body and the brain. This one is great for relieving stress and anxiety, and again, activates the parasympathetic system, lowers cortisol levels, enhances mental clarity, improves focus, concentration, and cognitive functions, balancing energies of the right and the left side of the brain and the body, and it also improves respiratory health. This one kind of became famous. Hillary Clinton on the campaign trail, they asked her how she dealt with stress, and this is actually the breath that she used to help control her anxiety and stress before speaking. So it's a wonderful one. I know it might look a little funny as you're doing it, but just doing this for a few rounds a day, a couple times a day, can really help balance that cognitive function and the anxiety. And this one, again, is called alternate nostril breathing. And I'll go ahead and let you finish a couple more rounds of that. Nice slow breaths. And again, you can always count the breath going in and as it goes across and exhale if that makes you feel better. Some people like to have that grounding of the counting. But just noticing how you feel as you do this breath. Then we'll go ahead and finish out that last round. And so that was 3 techniques that we've used. And as you might notice, your body might felt a little different, or they might slowly started getting more and more relaxed as you kept doing them. So as we continue, I want to do one more grounding technique here at the end of this. So you can choose one of those techniques if you'd like to continue doing them and practicing, or you can just allow your natural breath to return and just noticing what that is in this moment. And again, hopefully it's a little bit slower. a little bit calmer than it was when we started. And another great little tip, if you do want to relax yourself, a quick, easy way of doing that is counting your inhale. And perhaps that's like 4, 1, 2, 3, 4. And as you exhale, exhale for 5 or 6. Always have the exhales when you want to relax longer than your inhalations. This naturally relaxes the body. Okay. So with that said, I'm going to go ahead and just do a little grounding meditation. Again, still focusing on the breath, but just allowing a little bit more quiet time, I guess, in between this. So finding that still comfortable position, allowing your hands to drop if you're not doing the alternate nostril breathing, relaxing your jaw and your shoulders. Eyes can be opened or closed. If they are open, we want just a gentle gaze, looking down. And just taking the breath and noticing as it goes in and out without any effort. Just notice the body breathing itself. Slow, steady breaths. And if you have a busy mind and you wish to give it something to do, perhaps on the inhalation, repeating to yourself, I breathe in vitality, or simply, I am breathing in. And on the exhale, repeating to yourself, I release what I no longer need, or simply, I am breathing out. You can simply shorten that to the word vitality as you breathe in and release as you exhale. So using whatever word or mantra works for you in this moment, or just breathe in, breathe out. Slow, steady breaths. Exhales longer than the inhalations. Relax the jaw. Relax the shoulder. And if there's any tension in the body, allow that breath to go to that space. Allow the breath to heal that space. Again, just connecting to the breath. And again, the beautiful words of Thich Nhat Hanh. Breath is the bridge which connects life to consciousness, which unites your body to your thoughts. Whenever your mind becomes scattered, use your breath as a means to take hold of your mind again. And as you are ready and in your own time, if your eyes are closed, you may wish to open them. You may wish to round the shoulders, roll them back, gently move the head from side to side. Just taking a moment to thank your body for the breath and all that it does for you throughout the day. And as we close this session, my name is Renee, and it has been my pleasure to be here with you today. And as always, if you have any questions, please feel free to reach out to me at strive@kapnick.com. with any thoughts or questions. This session will be uploaded to YouTube later today, so you can go ahead and listen to it again if you'd like and to practice those techniques. If you do have any questions right now, please feel free to put them in the chat. I will stay on until people all leave the session. I'm happy to answer any questions. I will say, I guess I did forget to ask or say one thing. People often ask me, should I be inhaling or exhaling through my nose? We always want to try to inhale through the nose if possible, because the nose does have filters in it, and it does help to filter and clean the breath as you bring it in. But I always tell people, if it feels better to exhale out of the mouth, and some people do teach it that way, absolutely do it that way. In yoga, when we're doing that, inhaling and exhaling through the nose brings heat into the body. So you might notice that as well if you're doing it just in and out through the nose. But so I just wanted to say that, because that is a question I often get when I'm teaching these breathing techniques. But yeah, so if you don't have any questions, that's fine. And I do hope to see you again at the next meditation moment, which will be on December 10th at 2 p.m. Eastern Time. So again, if you have any questions, I will hang around. If not, I will see you then. Thank you.